This video is for basic facial, and we're going to start as if we just arrived at work. So the first thing that we always do upon arrival is wash our hands. So we're going to go right to the sink, wet our hands, get a coin-sized amount of liquid hand soap, wash our hands down to our wrists, and we're going to wash the back of our hands down to our wrists. We're going to wash our fingers, and we're going to wash the back of our fingers. We're going to wash our fingertips and our nails. We're going to wash between our fingers. We're going to wash between our fingers and our thumbs. We're going to wash our thumbs. We're going to wash our wrists. We're going to do all of that interlocking wash for a minimum of 20 to 30 seconds. And when we've done that good proper wash, we're going to rinse thoroughly underneath the running water. When we've got everything rinsed off, we'll grab disposable paper towels or a clean towel, dry our hands thoroughly, toss the paper towels in the trash. A clean towel will then go into a closed container until time to do the laundry. And then to finish the hand wash, we'll find our 70% ethyl alcohol hand sanitizer, and we will do exactly the same procedure as far as that interlocking cleanse with our hand sanitizer. And now we can move forward with preparing our room for our client. And we always want to do everything we possibly can before our client arrives, so that we are able to devote that service time to the client that they have blocked out and made the appointment for. So you don't want to be setting up or cleaning up when your client arrives. So let's talk about how to prepare your room for a basic facial. You would disinfect your workstation, bed, and equipment using a disinfectant wipe, of course, following manufacturer's instructions. You'll check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We're going to gather clean supplies needed for the facial service, storing in a clean, closed container. Turn on the hot cabbie and stock with at least 3 clean, wet towels. More may be needed depending on the client and the service. Fill clean steamer glass with distilled water and preheat the steamer. Dispense products needed for the service according to skin type and client's needs as follows. Prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula. Close the lid to the product and set the portion cup tray on the tray. Drape your facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean laundered sheets down onto a disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and headband on top of the first towel, along with a rolled towel to support the head and neck of the client. Save the third towel to lay across the client's décolleté. So we have prepared our facial bed. We have turned on our hot cabbie. We've made our towels. We have distilled water in our steamer. We've preheated it. And just to go over what's on my tray, ready to go, we have water, we have astringent, we have makeup remover, we have cotton rounds, 2x2s, 4 squares, we have disposable gloves, and wooden stick Q-tips in case our client is going to be having any extractions. We have toner, which is in a spray bottle. We have cleanser, we have exfoliant, we have a mask, we have massage product. We have a mirror, we have eye cream and moisturizer. We pretty much have everything we need for our facial good to go. Now what needs to happen is we need to be doing our client consult. And so just note before we meet with our client, I have clean hands. I will be cleaning them again before the service, but I would never greet a client with dirty hands. So I would be approaching my client with clean hands. So our client is on time for their appointment. We will walk and greet that client, escort them to the work area. And especially if they're a new client, we're going to make every effort, with every client though, to make them feel welcome. We're going to look in their eyes. We're going to give them a nice handshake. We're going to smile at them. If we have a mask on, we're going to tell them we're smiling. We are going to make sure that that client has a comfort level with us, because it can always be a little bit daunting to come to a new place, a new person servicing you. Also, you're talking about somebody's vulnerable area, their skin, their self-esteem, their looks, male or female. And so sometimes that can be a little humbling as well. So it's important to make people feel good. And Then we're gonna sit down and get to know our client a little bit and determine their preferences. We're gonna assess the client's needs. So we're gonna have our clients fill out a client consultation form, and that will answer a lot of questions that we're gonna go over now before we perform the service, just to confirm that they are able to actually have a basic facial. And it's gonna answer a lot of safety questions for us, and give us some information about them. So we're gonna assess the client's consultation form. We're gonna assess the client's skin by performing a skin analysis. And all we can do right now is just look at them to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We're going to assess the client's consultation form for any medications and products used within the last 72 hours. We will consult on any known allergies. Let's go over those two right there. So we need to know what medication they're taking, because that can affect the condition of the skin or response of the skin. And certainly if they take it every day or within the last 72 hours, we're going to need to know that. So all the things they take and why and what the side effects are. We're going to consult on any known allergies. And if we don't know a medication, we can ask them what it's for, and then we can certainly look it up to see if it affects the skin in any way. The allergy part, we need to know if we have an ingredient in one of our products that we were planning on using that the client is sensitive to or allergic to. We wouldn't use that, obviously. We're going to consult with the client on any facial surgeries within the last 3 months and if the client's under a physician's care. So we need to know what they've had done. They possibly may not be able to have a facial if they've had surgery, or if something is just part of the healing process, etc. Like, we've got to know all that. Then we need to assess if the client is prone to cold sores or fever blisters. If they're prone to them, we can move forward. If they have anything at all, healing or not, we can't proceed. It's too contagious and they would not be able to have a facial, and I'm sure they would understand that. Assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. All of those things are powerful ingredients that do things like exfoliate the skin on a very powerful level. So they can make them extremely sensitive, make the skin extremely sensitive to anything that you might do or use. Hydroquinone is a bleaching agent. These things could make it irritated, they get thin the skin. Lots of things we can't do. We need to pass that 72-hour window with using those products before they have a facial. And then assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. You have to pass that 3-week mark on the injectables, because you could move something around, it wouldn't be good, and you need to let the face rest if it's had fillers applied. So thankfully, our client hasn't had any of those contraindications, and there's more contraindications than that. You would be going over a lot more on your client consultation form. You need to know different things about the client from a health standpoint. You're going to be communicating in a more private setting when you're going over this client consultation form, so it's okay. You're going to get to the answers that you need to know, and then you'll know if you can go ahead and proceed with the service. And once again, like I said, my client is wonderfully okay to go forward, so we are going to take her into the facial room and then give her a little privacy. So everything is laid out for her: drape, towel, headband, all that, but we're gonna help her get more comfortable, but we're gonna leave and let her change first. So we're gonna close the door, give her some privacy, let her put her drape on. She can get under the covers on the bed, facial bed, and then you'll come and knock on the door, and when she gives you permission, you can return. And then you'll come over and help the client get even more comfortable. So what we're going to do here, we have a rolled towel that we're going to place underneath the client who's already on the facial bed. We have the headband to keep the hair out of the face while we're performing the service. You can certainly use a hairnet, anything that you feel like you want to keep the hair out of the face. And then we're going to take a towel and we are going to lay it over the blanket and a little bit over the décolleté, just giving her some of that added protection. And checking in to make sure the client's comfortable. While they're adjusting, we're going to go ahead and wash our hands before we start the service. So we wet our hands at the sink. We get a coin-sized amount of liquid hand soap and we wash our hands down to our wrist. And then we're going to wash the back of our hands down to our wrist. We're going to wash our fingers and, of course, the back of our fingers. We're going to wash our fingertips and our nails. We're going to wash between our fingers. We're going to wash between our fingers and our thumbs. We are going to wash our thumbs and we are going to wash our wrists. All of that interlocking motion for a minimum of 20 to 30 seconds. And then we can give it a good proper rinse under the running water. When we feel like we've rinsed everything thoroughly, grab some disposable paper towels or a towel, turn off the faucet, dry your hands completely. Towel goes in the trash, or paper towels go in the trash. If it's a towel that you use, it's now dirty and it can go in a closed container until time for laundry. Find your hand sanitizer, 70% ethyl alcohol, and sanitize your hands. And my hands are sanitized, so now I can perform the service. And the first thing that I'm going to do for my client is remove any makeup that she may have on. So we're removing makeup from the eyes and the lips, and then we'll remove the face makeup with the first cleanse. So I guess I should have clarified that. Removing eye makeup and lipstick or gloss. And now we're going to go ahead and do our first cleanse. And then you can go ahead and remove that initial cleanse. And then you are going to tell your client about a nice bright light that's going to be coming in. So you need to cover their eyes, because this is where you're going to do your professional skin analysis. And so we're going to cover up our client's eyes. So we're going to make sure before we bring in the lamp and turn it on that we have completely covered their eyes up. And what we're going to do now is we're going to bring the light over, and I don't have one, so we're just going to pretend, bring the magnifying light over, or the Woods lamp, whichever one you have, turn it over, and this is where you're going to be able to look through that magnifying lamp or Woods lamp and really identify some things about your client's skin. And you don't want to rush through this process. This is huge. This is where, and communicate with your client throughout. This is where you can talk to them if you want to, tell them what you're seeing. You're going to be looking at different parts of the face, neck for different things. Certainly pore size on the cheeks. You can look for any kind of excess sebum or blockage on the chin. I may be looking for signs of some aging around the eyes, like little fine lines. Same thing with the forehead. I'm looking for dehydration. I could be looking for hyperpigmentation, whether it's redness or brown. I'm looking for freckles, moles. I'm looking for across the board everything, maybe capillary issues. The reason that you're doing this is you have had a conversation with your client, especially if they're new, even if they're not new, about what their goals are with their skin or why they made the appointment, what they're trying to achieve. And you want to make sure you're analyzing to make sure that what they think is the cause is the real cause, or where you can see how to maximize the service, and also how to support them on a home care regimen where you can see things that you can recommend that would make a huge difference because they're at home more than they are with you. Also, future service appointments that you know would make a big difference based on their goals. So there's lots of information there that you're going over. You're also going to make note of their skin. You're learning their skin. You're going to make notes of improvements. You're going to make notes of setbacks. You're going to make sure that you take the time, whether it's right after the appointment, if you have that time, to write down on either your client card, or if you're using a software system for your client, all the details about the skin. And that way, if something changes within their skin, like I said, positively or negatively, you can communicate that with them. And certainly if there's a change in something like a freckle or a mole and it's out of your scope of practice to treat that, and you want to refer them on to a doctor, you're going to be able to do that, and maybe you would notice it even before they would. So this is really where you take the time and make sure that you remember, because you won't be able to stop now and make notes. So if you have a client coming right after, you got to jot those notes down quickly, and then maybe get to more detail at the end of your day or when you have a break in your day. So you've really done a really good analysis here. Everything is communicated. You're going to turn your light off, take it away, and then you can remove the coverage on your client's eyes once you know that their eyes are then protected. And then you are going to go ahead and get started with your second cleanse. So the first cleanse is just kind of setting the stage for clean skin. This one is going to be real critical. And then we'll go ahead and remove the second cleanse. And everyone may not need it, but we're going to go ahead and do a third cleanse for this client following our rubric exactly. Just play it by ear and see if you can do that. 3 cleanse. They need it. Third and final cleanse over here. And we're going to go ahead and remove that third and final cleanse. And after that third cleanse, we are going to tone, and we are going to make sure that our spray nozzle does not come into contact with the 2x2. Just going to spray it, and then we'll be ready to tone. And then we will now move forward after we've toned to exfoliation. So I'm going to get about a pea-sized amount of exfoliant, and I am going to spread it around my client's face and neck. And once I do that, I am going to massage it in for about a minute or two based on manufacturer's instructions. And I'm also, of course, avoiding the eyes, the nose, and the mouth, like I'm doing for each phase of the facial. So we always want to not get it in the mouth, get it up the nose or in the eyes. So we're just very cautious of that. So for this, it's a physical exfoliant, and so I'm going to massage it in for 1 to 2 minutes. And so there's physical exfoliants, there's chemical exfoliants. You're going to be following the instructions of the manufacturer for each part of the facial and the products that you're using, of course. And once you finish that massage, you're going to proceed with the next step in exfoliation. And I don't have the equipment, so I'm going to read through it with you and explain what happens next. So you would be retrieving the facial steamer that you prepared before your client arrived with the distilled water and doing the preheating. And you're going to turn it on. You're going to position the steamer next to the facial bed and make sure that it is facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, you can position the steamer 16 inches over the client's face and aim it at the client's chin for even distribution on the face, allowing the unit to function for 3 to 5 minutes. Remove the steamer from the client's face, return the steamer to its previous location for disinfection. So I would go get my facial steamer, bring it over close to the bed and turn it on, making sure that the mister is facing away. And once you see that even mist coming out, you can turn that mist about 16 inches away from the client's face towards the chin and let it, whether it's this way or this way, you're gonna let it even flow that mist over the client's face for 3 to 5 minutes. So we're obviously doing a video, we don't have the equipment. We're gonna proceed as if the 3 to 5 minutes has elapsed. Then you would turn that away from the client, turn it off, and go ahead and put it back where you retrieved it from. We'll disinfect it after the appointment is complete. So I would reach into my hot cabbie, which I don't have one of those either, so I'm just gonna pretend to get out a nice hot steam towel. And I would shake it out, test the temperature on my wrist. Once I feel like it's comfortable, I would test it on my client's collarbone, and then she says it's fine. So I'm gonna go in here and I'm gonna cover her face, but I'm gonna leave her nose out so that she can breathe while that nice little steam towel is on top of her face. And you'll feel the towel start to cool down within about 20 to 30 seconds. So you can utilize that time once, keeping the nice little pressure when the steam towel's on, and as you feel it start to cool down in a minute or so, 20, 30 seconds, then you can take it off the client's face. And then when that happens, you'll also then be obviously removing the exfoliating product that you had put on the face. And make sure you get it off the neck as well, as you did have exfoliator on the neck. And then you want to dry your hands thoroughly, because this is the part of the facial that you would perform any extractions if you need to. My client doesn't have a huge need, but there's a couple of areas that we want to get. So we're going to put on disposable gloves. And if your hands are wet, that can present a challenge. And you can perform extractions in a couple ways. You can use cotton rounds soaked in astringent, and you can put them on the fingers, and you can press, do your extractions and kind of work your way around the cotton rounds and then toss everything. I'm gonna use wooden stick Q-tips for my extractions. So for every extraction, you're gonna need 2 wooden stick Q-tips soaked in astringent. You can perform more in extraction and you throw it away and you get 2 more, et cetera, et cetera. So she doesn't have a lot of extractions that need to be performed. We've just got a little area around the nose that we need to get at to take care of that for her. We got one more that we need to do. And then she's good to go. So you would be removing your gloves at this point and tossing them. And then you would do a tone. So we're going to tone again. We're going to make sure that the nozzle does not come in contact with the 2x2, and then we're going to do toner. Now with your extractions, you don't want to perform those any more than 5 to 7 minutes because it can be somewhat painful, and that's a long time to ask a client to deal with that kind of pain. But you do want to do your cleansing part of the skin. So if they need to have the extractions performed, do it. Just make sure that you proceed quickly and try to make it as painless as possible. And once you're finished with your toner, you will be able to move forward with the massage portion of the facial. Now, if they have severe acne, obviously you would be doing something else. You would be doing massage. But our client doesn't. She only needed a couple of extractions. So we're going to move forward with our massage. And one note here is that you want to make sure you get enough of your massage product on your hands before you begin the massage so that you don't have to touch the client, leave the client, touch the client, leave the client, because it can be not as relaxing to have your hands on and off your client. So I'm going to go ahead and spread a little bit of that massage product out on my client before I start the massage, so I don't have to worry about retrieving more product when I get to a different area on the face, neck, or décolleté there. And then you can let your client relax and you can begin the facial or the massage part of the facial. So we're going to remove our massage product. And I'm going to use another steam towel from my cabbie, checking that temperature, checking it on my client. Nose out. Waiting till you feel that little cool down begin. And remember, with this one, you may need to take it down even a little bit lower as you applied that massage product a little bit, a little on the décolleté there. And then we will apply our mask. And I'm going to use a fan brush to apply the mask. Always, once again, following those manufacturer's directions. And then, of course, we always avoid the eyes, the nose, and the mouth. And of course, based on our, client skin condition, based on what you're using, following those directions, you would then determine how long that you would leave the mask on for. And let's say for this one, it could be anywhere from 5 to 10 minutes. So that time for us has already elapsed because we're in video mode here, so we're going to pretend like it has. So we can now go ahead and remove our mask product. And once you're finished with that, you are going to do your final tone. So we've got our 2x2, we've got our toner. We're not going to let it come into contact with the nozzle, and we will tone. And from there, you will be able to apply your eye cream and your moisturizer, anything else skincare wise you want to. So I'm going to be applying a little eye cream, and I'm going to be using my ring finger to do so because it's the most delicate of the fingers. And I take a little bit of tiny bit of eye cream, I rub it together in my ring fingers, and then I'm going to lightly tap that eye cream on the zygomatic arch and the brow bone. And then I'm going to get some SPF moisturizer, hydrating moisturizer with sunscreen for her. And I'm going to rub my hands together, of course, and press that moisturizer in on her face, neck, anything that's exposed, décolleté if that needs be as well. It's daytime, she's got to be protected. And we talked about basic skincare in our consultation, like a home care routine. She does not have a good one, and so we're going to review that in just a minute to make sure she goes home. And she knows that sunscreen and eye cream, things like that, are really important just to have a really good basic routine. And then we're going to obviously give her a little lip hydration as well, because everybody wants to have moisturized lips in the fall and winter. And now that we're finished with the facial, we're going to present her skin, and she's going to be blown away by how amazing it looks just by her very first service with great products and doing the right thing that her skin needs. So we're going to go ahead and give her some privacy and allow her to change alone, and then meet us back out in that client consultation area so that we can go over any maintenance and aftercare. And like I previously stated, we're going to be going over that basic routine. She doesn't have a cleanser, she doesn't have a moisturizer, she doesn't have any sunscreen. So we're going to go over a nice little AM PM routine and make sure she has what she needs for morning and night, and then get her booked for her next service so that she's staying consistent with these skincare goals. So we've made some recommendations for her. We're getting her checked out. She's going home with her product. She's booked her next appointment, and now it's time for us to get back into our room because we need to break down and clean up and disinfect for our next client that's coming in. So the first thing we do when we get back in that room is we look for any single-use items that we might not have thrown away and go ahead and toss them. We're going to look for dirty implements. We'll get those in a closed container labeled to be disinfected. We're going to take all the sheets and the towels off the bed, all the dirty linen, and we're going to put it in a closed container until time to do laundry. Then we're going to identify and find a proper cleansing agent. We'll read and follow the manufacturer's directions for mixing and usage, and then we'll go ahead and use it to wipe down our workstation and area, removing any dirt and debris. Then we're going to identify a disinfectant that is bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting. We're going to read and follow manufacturer's directions, which means we need to find some disposable gloves and put them on. Once we do that, we follow those manufacturer's directions for mixing and or using appropriate aerosol disinfectant. We disinfect electrical equipment and store it in a clean area separate from other implements, and then we can go ahead and throw those gloves in the trash. And it's time for that big final hand wash so that we can move forward. So we go to the sink and wet our hands. We get a coin-sized amount of liquid hand soap, and we wash our hands down to our wrist. We wash the back of our hands down to our wrist. We wash our fingers, and we wash the back of our fingers. We wash our fingertips and our nails. We wash between our fingers. We wash between our fingers and our thumbs. We wash our thumbs, and we wash our wrists. And we do all of that interlocking wash for a minimum of 20 to 30 seconds. When we feel like we've gotten everything nice and washed, we thoroughly rinse it underneath the running water. Properly rinsed, we can grab some disposable paper towels or a towel. We're going to turn the faucet off with the towel, dry our hands completely. If we use the disposable paper towels, you can throw them in the trash. If you used a towel, it's now dirty and it can go in that closed container with the other dirty towels until we do the laundry. Then you're going to grab that hand sanitizer. You've got 70% ethyl alcohol hand sanitizer, and you're going to sanitize your hands. So you're going to make sure that you get those hands and you do that same motion of cleanse down to the wrists and the back of the hands down to the wrist. All the things that we just talked about, fingers, back of the fingers, between the fingers and the thumb, fingertips and nails, thumbs, wrists, get it all done. And then you've officially finished that hand wash. So this concludes the basic facial video.